Dear friends, it's high time we realize the importance of mental health because mind and body are interlinked through an array of chemicals, through hormones, and through the immune system. So, whenever there is significant stress that goes in the mind, it reflects in the body in different forms. Maybe in the form of irritable bowel symptoms, where people have diarrhea or perhaps constipation, or perhaps skin related problems like psoriasis, or perhaps fluctuations in blood pressure or in sugar levels. So there are many physical manifestations of stress alongside the stress that a person perceives in the mind. It's high time that we realize its importance because psychiatric disorders are treatable. We should not be stigmatizing psychiatric disorders because no family is immune to psychiatric problems. In today's age and stage, and particularly in the current testing times of pandemic, it's not just affecting our physical health, it's also parallelly affecting our emotional and behavioral health. Quality of life suffers a lot, not only for the individual who suffers from psychiatric problems, but also of people related to that individual. So it's very important to maintain harmony within and harmony in one's environment, and for that one needs a healthy mind. A healthy mind and a healthy body combination is what is required in today's age and stage of life that we are living in. Because of pandemic, people are restricted to their home environment. There are significant changes which are happening with respect to jobs. At times there is job loss, at times one is working from home, at times one is working part-time. So there are many changes which are happening with respect to one's lifestyle. What we are also seeing is there's the significant disturbance in one's sleep-wake schedule. At times people get hooked on to their mobile phones or to the media, and because of that also they are not able to utilize their time in a constructive manner. And when you are consuming a lot of negative news, that further escalates your apprehensions and your anxiety. Recently, we at the Department of Mental Health and Behavioral Sciences at Max Hospital conducted two surveys, one for the adult population of the country and the other for the adolescent population. And what we have found is that there's significant stress that people are experiencing, so much so that over 50% of the respondents were facing significant anxiety symptoms amongst the adult population, and almost 1/4 were suffering from significant clinical depressive symptoms. We also found that about 3% of the people who were current levels of distress call for a multi-pronged, multidisciplinary approach from policies to implementation. So let's join our hands together to help ease out the burden, whether it is financial, whether it's related to job, whether it's related to career, whether it's related to certain academic accommodations, whether it is related to opportunities that we can provide to people at this hour, so that nobody feels left out and we all work in tandem across disciplines to be able to survive through this pandemic in a positive and healthy manner. And two, we should not hesitate from seeking appropriate, timely psychiatric intervention, because friends, psychiatric disorders are by and large treatable. They need to be timely identified and rectified. No person, no family is immune to it. 1 in 4 people are likely to suffer from some or the other form of psychiatric disorder, be it anxiety, be it depression, be it certain psychotic symptoms, be it any form of insecurity, some personality problems, or substance or alcohol misuse. So one needs to seek appropriate, timely help and reach out, because these things are treatable and they have a strong impact on one's health, on the health of the family, and the health of the society at large. Thank you so much.